Hello aspirants, welcome to GDC English classes YouTube channel. So in this video we will discuss a interesting thing, and especially this is a new series launched for especially GDC aspirants like Pharma Hulk series. So in one video we will discuss three subjects of same term. So for example, atropine. So for atropine, we can discuss pharmacognosy, we can discuss medicinal chemistry, we can discuss pharmacology also. Like this study, like this approach, definitely strengthen your preparation and definitely increases your confidence, and definitely it will make easy entry of content into your blood brain barrier. You know that blood brain barrier allows lipophilic substance only. If you really passionate about your GPAT preparation regarding your pharmacology exam preparation, definitely like this approach, make the content basics concepts easier in the form of lipophilic, so that lipophilic content easily enter into the blood brain barrier. And especially you know that nearly 35 to 40% of questions in the GPAT, they are coming from the subjects like pharmacognosy, medicinal chemistry, pharmacology. So if you really focus on this way, definitely you will get success in easy way. And definitely, so Pharma Hulk series help in that way. It boosts your preparation and definitely strengthen your confidence. So enter into the session. So in this session, our focus is mainly on the atropine. So you know that atropine is one of the tropane alkaloid characterized by basic tropane nucleus. And regarding its synonym, it is deadly nightshade leaf, and even in olden days, it is generally applied to the eyes of ladies people to become dilate their people and widening of these people to look beautiful at belladonna, beautiful eyes. And biological source is regarding the biological source, atropa acuminata, accumulation. There are more people are accumulated in the India. So Atropa acuminata belong to the Indian source, and Atropa belladonna is a European type. And regarding the family Solanaceae, all tropane alkaloids are belongs to Solanaceous family. But there is a cocaine. Cocaine is a tropane alkaloid, but not belongs to the Solanaceae family. Coca belongs to the Erythroxylaceae family. And coming to the microscopy, all propane alkaloids are commonly containing an isocytic stomata. This an isocytic stomata, also known as cruciferous, also known as unequal celled type of stomata. So simply here, an without isocytic, same arrangement of cells, but an without same arrangement of cells. That's why it is unequal cell type of stomata, and they are not equal, they are cruel. So like that you can remember cruciferous type of stomata. When coming to propane alkaloid coca leaf, cocaine containing parasitic stomata like senna leaf. But coca leaves containing nothing but cocaine containing propane ring, but they are not belong to the family Solanaceae. That's why coca leaf is a propane alkaloid non-Solanaceae family. Propane but non-Solanaceae family. And coming to the trichomes, it containing covering and the glandular trichomes. It containing covering and glandular trichomes. And especially atropine contains the atropa belladonna containing calcium oxalate crystals in the form of sandy crystals. And coming to the chemical constraint, so nearly zero point 0.4 to 1% propyl alkaloids are present, especially atropine in the form of hyoscyamin L as well as D isomer. I hope you know that the L isomer is biologically active. The L isomer is biologically active, and also containing hyoscine or scopolamine, and hyoscine or scopolamine also L isomer biological active. Generally, both hyoscine are parasympathetic, Hyoscine mainly for treatment of motion sickness, and hyoscine atropine having many clinical application. We will discuss further. And another important point, the Atropa belladonna leaves containing scopolamine, chemically 𝘿𝙄𝙎𝘾𝙐𝑖𝑛, which shows blue fluorescence. So this is what is the synonym? Biological source family microscopy leaves, and also nothing but leaves containing extra alkaloid, and these are the chemical constraint. So hyoscine atropine exists as a 2 isomer, L and D isomer of hyoscine, and L isomer is active isomer regarding the pharmacological activity. Okay, and moving to the next, adulterants and substitutes. The adulterants and substitutes of Atropa belladonna here: Phytolacca americana, Solanum nigrum, and Aleanthus glandulosa. So adulterants are substituents. So these three species used to adulterate or substitute the Atropa belladonna as well as Atropa acuminata. So the common features like all tropane alkaloids commonly containing tropane nucleus, and mostly all tropane alkaloids are true alkaloids. What is the meaning of true alkaloid? It should containing nitrogen within the ring with heterocycle, and it should be derived from the amino acid. And especially here, these propane alkaloids are derived from the amino acids ornithine. Next. So here, if you observe the simple chemistry, generally the propane alkaloids are mixture of tropine as well as tropic acid. So condensation of this propine with the tropic acid will give atropine. And especially the scopolamine. The scopolamine or hyoscine contains etc. epoxide group. There is a etc. epoxide group is present in the scopolamine or hyoscine. And especially the semi-synthetic derivatives of atropine, ipratropium, and also 𝘖𝙬𝙎𝑃. Both are semi-synthetic derivatives, and these are selectively block type 3 muscarinic receptors in the lungs, bronchial smooth muscle, helps in treatment of COPD as well as asthma. And regarding the chemistry point of view, this ipratropium containing isopropyl group in this structure. Ipratropium, semi-synthetic derivative of atropine, it containing isopropyl group. When coming to the 𝘖𝙬𝙎𝑃 containing two thiophene rings, two extra thiophene rings in the 𝘖𝙬𝙎𝑃. So medicinal chemistry also definitely very easy. If you understand, if you focus, definitely it will reach into your blood-brain barrier. So regarding this, commonly containing tropane nucleus, the difference between scopolamine and atropine, extra epoxide ring is present in the scopolamine, nothing but hyoscine, and ipratropium containing isopropyl group, especially near the N, and 𝘖𝙬𝙎𝑃 containing two thiophene rings. Next, so coming to the pharmacology, as you know that atropine is a parasympatholytic. It blocks all types of muscarinic receptor non-selectively. Muscarinic receptors are belongs to G protein couple receptors. G protein couple receptors also known as metabotropic receptors, also known as 7 transmembrane heptahelical receptors, also known as serpentine receptors. And here atropine is a parasympatholytic, non-selective in nature, can block all types of muscarinic receptors. So without wasting of time, I just place the flow chart here. So anticholinergic drugs, these are muscarinic antagonists. So anticholinergic drugs, nothing but these are muscarinic antagonist, blocks muscarinic receptor, also known as atropinic drugs, and tropinic drugs, parasympatholytics. So regarding the natural alkaloid, atropine hyoscine also known as scopolamine, and hyoscine L isomer is biological active, mainly for treatment of motion sickness. Coming to the semi-synthetic derivatives. Atropine methonitrate, homatropine, hyoscine butyl bromide, ipratropium bromide, 𝘖𝙬𝙎𝑃 bromide. So ipratropium bromide, 𝘖𝙬𝙎𝑃 bromide selectively block type 3 muscarinic receptors. type 3 muscarinic receptors on the bronchial smooth muscle helps in the treatment of COPD and asthma. So, semi-synthetic derivatives, they commonly containing basic nucleus from the atropine and some extra groups are added by synthetic process. And pure synthetic compounds. Pure synthetic compounds are different from the natural compounds. Pure synthetic compounds they prepared in the laboratory. Among the synthetic compound, mydriatics. So mydriatics are drugs or substances they cause dilation of pupil of eye by opposing acetylcholine action. Acetylcholine causes meiosis, constriction of pupil of eye. When coming to the mydriatic, they causes dilation of pupil of eye. Examples the examples of this mydriatic cyclopentolate tropicamide as well as homotropium also. Homotropium also used as a mydriatic. You can remember like HTC, homotropium, tropicamide, cyclopentolate are mydriatic. They can cause dilation of pupil of eye. Next, vasicoselective. Vasicoselective. Vasicoselective means they selectively acts on the urinary bladder. So there is a type 3 muscarinic receptors on the urinary bladder and selectively antagonize that urinary bladder type 3 muscarinic receptor and reduces excess urine frequency. So these vesicoselective drugs are commonly used in the urinary frequency, nothing but urinary incontinence, where the person feel discomfort to urinate, especially if acetylcholine function increases. What will happen? Excess acetylcholine function leads to excess urination, increasing frequency in the urination. To reduce that excess frequency in the urination, these vesicoselective drugs are useful. These vesicoselective drugs selectively block type 3 muscarinic receptors and by blocking that they cause relaxation of urinary bladder. These drugs are oxybutynine, flavoxate, 𝘿𝙄𝙎𝙄𝙊, darifenacin, solifenacin. You can also remember like soft bladder. Soft bladder. So what is simply here? S means solifenacin, O means oxybutynine, F means flavoxate, T means 𝘿𝙄𝙎𝙄𝙊, and D means darifenacin. Darifenacin. So they cause softness of bladder. They relax the bladder and reduces excess frequency of urination because of excess acetylcholine function of urinary bladder. Next, anti-Parkinsonism drug. So anti-Parkinsonism drugs nothing but parasympatholytics used in treatment of Parkinsonism because in the Parkinsonism there is a domination of acetylcholine function. To reduce that excess domination of acetylcholine function, parasympatholytics like trihexyphenidyl, also known as benzhexol, procyclidine, biperidine, benztropine. These are the drugs used in treatment of Parkinsonism as a parasympatholytics. Benztropine, benzhexol, even biperidine. These drugs are used in treatment of Parkinsonism as a anticholinergic drugs. Next, anti-secretory, antispasmodics. They reduce unnecessary spasms of the muscle as well as they also reduce the secretions. Among this tertiary category, dicyclomine, valithamate, pyrenzapine. So pyrenzapine, pyrenzapine are the two drugs. Pyrenzapine, pyrenzapine are the two drugs. They selectively block type 1 muscarinic receptors in the gastric glands, helps in the treatment of peptic ulcer. Coming to the quaternary compounds. So quaternary ammonium compounds nothing but they are cationic in nature. Because of their cationic in nature, they are polar in nature. They are polar in nature. They having poor absorption distribution. And quaternary ammonium compounds having poor penetration to blood-brain barrier, placental barrier. They not easily crosses the biological membranes. Because of that, quaternary ammonium compounds having poor absorption distribution. But tertiary amines are lipophilic in nature. They having good absorption to the biological membrane, blood-brain barrier, placental barrier, and these are having good absorption as well as distribution. So this is simply regarding the classification of parasympatholytics in easy way according to their clinical applications and also some important tricks based on the requirement. Okay. So quaternary ammonium compounds like propanthalin, oxyquinonium, gliadinium, symmetropium bromide, isopropamide, glycopyrrolate. Glycopyrrolate. Glycopyrrolate can be used as a pre-anesthetic agent. Propanthalin is a anti-ulcer property. It is having anti-ulcer property. And dicyclomine, especially in the children, it is used as a syrup to reduce the gastric-related pains, abnormal abdominal pains. Okay. And here the pharmacological actions. Here the pharmacological actions of the atropine on total body organs. When coming to the central nervous system, control tremors, rigidity of Parkinsonism also. In Parkinsonism there is a rigid, reducing muscle movements. It is not easy to contract muscles in the Parkinsonism. That rigidity can be controlled, and tremors also controlled. Tremors nothing but unusual contractions like shivering. And on the CVS through M2 receptor, generally what acetylcholine will do? Acetylcholine causes relaxation of cardiac muscle, but atropine is a parasympathetic. It stimulates the heart muscle and produce tachycardia, but started with initial bradycardia at low doses. And especially on the urinary tract through type 3 muscarinic receptor, decrease the tone of detrusor muscle, increase the trigone sphincter, and causes retention of urine. Acetylcholine parasympathetic, it causes increases urine output, but atropine decreases urine output. Next, urine output become less urine output on the kidney, less urine output. Next, coming to the bronchi containing type 3 muscarinic receptors, so causes relaxation of bronchial smooth muscle, reduces the bronchial secretion, and helps in the treatment of asthma as well as COPD. And I also type 3 muscarinic receptors are present. Atropine causes passive mydriasis, nothing but dilation of pupil of eye, and cycloplegia, paralysis of ciliary body, loss of light reflex will be there. Generally, if light is focusing on the eye, our reflexes will be there. But because of this action, the muscle of eye relaxed and loss of light reflexes. Decreased intraocular tension, contraindicated in glaucoma. Decreases intraocular tension. And effect on GIT, especially decrease the secretion of gastric content, decrease the motility and relieve the spasm of GI smooth muscle, reduces the sphincter tone, may causes constipation. Acetylcholine promote the gastric muscle movements, but atropine reduce the gastric muscle movements, may cause constipation. And especially on the glands, reduces secretion of glands, So if you have awareness about how acetylcholine is showing its action, then atropine shows action opposite to the acetylcholine. Acetylcholine is a parasympathetic and it agonizes muscarinic receptor. Atropine is a parasympathetic. It blocks muscarinic receptors by prevent binding of acetylcholine to the muscarinic receptors. Next. So here the therapeutic uses, the clinical applications of our atropine with a trick atropa. So as a mydriatic, so it causes cycloplasic. So especially during the ophthalmology, it is used as a pre-anesthetic, as a mydriatic to dilate the pupil of eye. And T, traveler's diarrhea, especially during the traveling, there is a chance of we are taking outside food. So because of different reasons, there is a chance of diarrhea. And rapid, early onset mushroom poisoning. So mushroom nothing but Amanita muscaria gives muscarin. Muscarin is one of the parasympathetic. So muscarin is here one of the natural alkaloid from Amanita muscaria. Based on this muscarine alkaloid only, the muscarinic receptors are named. So excess intake of this mushroom into the body may produce poisoning. Especially in the early stage of this mushroom poisoning, our atropa will be helpful. Atropine block muscarinic binding to the muscarinic receptor, and also organophosphorus poisoning, and also for as a pre-anesthetic medication, and also control the abnormal rhythm. Especially atropine helps in used in bradycardia, because bradycardia is because of parasympathetic action, but atropine produces tachycardia due to its parasympathetic action on the cardiac muscle by blocking M2 receptors. And next, adverse effect of our atropine with help of a trick, datura, one of the tropion alkaloid. And D, dry mouth, heart dry skin. So dry mouth, decreasing salivary secretions, and heart dry skin due to decreasing sweating, accommodation paralysis due to effect on the eye, and a tachycardia due to cardiac muscle contraction, urinary retention due to relaxation of smooth muscle of urinary bladder, especially detrusor muscle, and R, respiratory depression. So atropine decrease the function of respiratory system and decreasing the capacity of respiration and causes ataxia, lack of voluntary contraction, voluntary contractions, decreases the muscle movements, lack of coordination between the muscle movements. Okay, so this is regarding today our discussion on the Hulk series of atropine. So the simply the intention of this series is at one subject, at one drug, we can study three different subjects, and definitely the way of focus also help to remember the things in easy way. I hope definitely this video helped to you. If any suggestions are there, please comment in the comment box. And here my question, what is the enzyme reactivator? What is the example of drug that reactivate the acetylcholine esterase enzyme and helps in the treatment of organophosphorus poisoning? So name the drug acetylcholine esterase enzyme reactivator helps in the treatment of organophosphorus poisoning. Comment in the comment box. So I hope this series definitely helped to you. So like this, I will made number of videos on like already atropine done, next digitalis, next some vasaka, next all alkaloids, around 30 important pharmacognosy drugs are there. For that, I will discuss pharmacology, pharmacognosy as well as medicinal chemistry also. So if any suggestions are there, kindly let me know. Thank you and all the best.